Dr. John Torres here with NBC News on this Facebook Live, and today we're going to cover some coronavirus headlines to give you a little bit more information, but perhaps as important, or maybe even more importantly, we're going to answer your questions. So if you have any, please send them our way. But first and foremost, it's Memorial Day weekend. Please enjoy the weekend as best you can. Try and get outside and get some exercise if you're in an area that doesn't have much activity of coronavirus. If you're in an area with activity of coronavirus, as much as you can get out and get in sunshine, please do, but do it safely regardless of where you are. On top of that, let's talk about a couple of headlines. One, vaccines. There's a big race for vaccines right now. You're hearing a lot of companies talk about where they are, the fact they're going from phase 1 to phase 2 or about to start phase 1, or that they've tested in rhesus monkeys and they seem to be doing okay with the monkeys as far as developing antibodies. But the main thing is, are they actually having much success? Yes, they are having a lot of success, but the issue is the success isn't necessarily as much as a lot of people would think, or as a lot of the hype that's out there. Number one, if you hear them talking about monkeys and them being able to develop antibodies in monkeys, that's fantastic because their immune system is a lot like our immune system. But that doesn't mean it's exactly like our immune system. So you do have to be a little careful there because they still have to test it on humans, and these companies are doing that. The other ones, there's a couple of companies that have gone through phase 1 trial, and now they're moving into phase 2. Here's the way vaccine research works. Phase 1, about 50 people or so, just to see if it's safe, but also kind of looking at whether it works or not. Phase 2, many more people in the hundreds, usually 500 to 600, to see if it's safe and if it works. And then phase 3 is a huge trial, tens of thousands of people usually, to try and find out if it works. And they look at specific age groups, particularly in phase 2 and phase 3, saying, okay, who's going to get the vaccine? Let's test all that age group to make sure people with certain conditions, whoever we're going to give it to, we want to test it as well. As you can tell by this, it's a complicated process. It takes a while. And with biology, you can only go at a certain pace. You really can't go much beyond that. So if you're hearing about them saying it looks like summer it might come out, most experts are skeptical, saying maybe at the end of the year, maybe, but more likely 12 months, which would be February, to 18 months, which would be 6 months beyond that. So again, we are probably going to get a vaccine. It looks very promising, but it's still going to take a while. That's headline number one. Headline number two, the CDC has come out with a report saying they looked at the statistics, they looked at all the numbers of cases, and they're finding out that people, a couple of things. One, people without symptoms seem to be spreading it around 35% of the time. If you've heard me, if you've heard other experts, we say usually anywhere from 25 to 50% of the spread of coronavirus is from people that don't have symptoms, asymptomatic carriers of coronavirus. Well, now the CDC's fine-tuned that a little bit with their numbers and saying it looks like about 35%, which is right in that range of 25 to 50%. So that's not telling us a lot, but it is helping fine-tune the numbers here a little bit. On top of that, they're looking at death rates. It gets a bit complicated the way they're calculating death rates, but it seems to be lower than what we originally thought it was. A lot of experts have said the same thing. The more people we find out have coronavirus that recover from it, the lower that death rate goes. But the bad news is we're still having deaths from coronavirus. It's still out there, so we still need to be extra careful. On top of that, the CDC also came out with a statement saying that coronavirus is almost always spread through the respiratory route. That means breathing it in mouth and or nose from somebody who's coughing or sneezing. If we're far away, if we're closer to them breathing can possibly do the same thing. So the bottom line here is, even though they say it's doesn't spread much through contact, in other words, me touching a surface and then touching my mouth, nose, or eyes, it still can spread a little bit that way. So you still need to wash your hands. Maybe don't need to be so overly concerned about the things you bring into your house that get mailed to you or groceries that get delivered, those types of things. But you still want to make sure they're clean, you're clean, your hands are clean. But priority number one, that respiratory spread, masks, social distancing, that's the huge key behind all this. So let me take a little bit of a moment here now, revamp what we just talked about, then we'll get to viewers' questions. Number one, vaccine. The race is on. This is unprecedented, the amount of manpower, woman power, research power that's going into this, the amount of money that's going into this, unprecedented. It's still going to take a little bit of time to get this. And if you think about the history of vaccines, 4 years is the fastest, 11 years is the average, 1 year phenomenally quick. I think we'll get there. It'll still take a little bit of time. CDC now saying that it looks like 35% of all coronavirus cases come from people that don't have symptoms of coronavirus, those asymptomatic spreaders of coronavirus. So you need to be careful of anybody who you're around that's not necessarily in your intimate circle. your quarantine of people that you trust, mainly your family members. Anybody else outside that, you need to make sure you do that social distancing, wearing masks, washing hands. Those are the things that are going to keep you safe, even during the summer when things calm down a little bit. Let me see if we have any questions.
Can we be safe going back to church now?
So the big question is, can we be safe going back to church? And that's because President Trump just had a press conference and he said they're going to put out some guidelines about religious events. What can happen if you go to church, if you go to religious assemblies, those types of things. They're making them essential workers, basically saying if you go back to church, that's an essential activity. You do need to be a little bit cautious if you do go back. Number one, that social distancing is still going to be the key because you have your core of people that you're around. That's what we call your quarantine. And that's usually 5, 6 people or so, your family members. I've talked about expanding that a little bit, maybe to 10 people, but 10 people you inherently trust, that you know they've been doing all the right things over the last couple of weeks to keep themselves safe. 14-day incubation period, so that 14 days, that 2 weeks is important. If you go to an assembly, if you go to a church, if you go to a religious ceremony, you want to be careful of who you're around. Make sure you maintain social distancing, wearing masks if you can't. On top of that, sharing of things there is going to be something that you have to be very, very careful with, because even though the CDC says it's not spread much through contact, it can still be spread through contact. So you need to be careful. So again, they're saying that they're putting out guidelines for religious services. Look at those guidelines, adhere to those guidelines, and particularly social distancing. Super important even for religious ceremonies. But next question.
Could you please explain why people should wear cloth masks? Some people are not sure about what that means, and is it better because we can wash them?
So the question is why people should wear cloth masks. Is it better because we can wash them? So the truth is the N95 mask is the best of all masks. That gives you protection from essentially 95% of the viruses that are out there. It's very good protection. But if you've ever worn one, they can be cumbersome. They're hard to fit. If you don't fit it properly, then you're not going to get the protection you think you're getting. And they're warm. They get pretty warm as you start wearing them. Most people last about 30 minutes. So they're a little difficult. The reason the cloth mask recommendation came about is, one, because N95s, again, are a little hard to wear, hard to get, hard to fit, but also back in the early days, we didn't have much PPE around. We didn't have much of that personal protection equipment. We were trying to save it for the frontline workers, hospital staff, ambulance workers, police, fire, those types of people that could not avoid getting close to somebody because they were trying to save somebody's life. They needed those. The rest of us, they said, let's use cloth masks. The beauty of cloth masks is they're easy to make. They're out there. A lot of people have them. You can clean them after you come back inside, which is important, especially if you've been in an area where there's potential contamination. And they have found out, yes, they do protect you, but that doesn't mean you can avoid the social distancing, that's 6 foot. That just adds to it on top of doing the social distancing. So you want to be very careful with that. But regardless of which mask you wear, you want to make sure you wear it appropriately. And with the N95 masks, a little bit of a story. Here's how we do it in the medical communities. We wear these masks, and usually every year they test them on us. And the way they test them on us, the way they do it is kind of funny. They put this plastic cylinder over your head, and then they push in there basically aerosolized sucrose or fructose, aerosolized sweetener, and they ask you if you can taste the sweetener. If you can taste it, that means that your seal on the mask isn't that good and a virus could get in there. And so think about how cumbersome all that is and how time-consuming it is to test. And usually the first time you do it, you realize, okay, I can test that sweetness. I need to readjust my mask. And that's why we're saying N95 gives you good protection, but unless you do it properly, it's not going to give you all the protection it's made to give. Cloth masks, they work well too. Thank you.
Why aren't there more restrictions on smoking in these businesses that are opening? Because it is a respiratory illness.
So the question is, why aren't there more restrictions on smoking in businesses that are opening? Because it is a respiratory illness. That's a fantastic question. I don't have a good answer for you because as a health provider, I think there should be restrictions. Secondhand smoke is real smoke, and it can cause health issues as well, so there should be restrictions. And we do know that one of the risk factors for getting complications from coronavirus is tobacco use, people that use tobacco. And so that people using it can cause issues, people who are exposed to secondhand smoke possibly. So you want to be careful with that. So if you are a business owner, please think about eliminating smoking inside your environment. Number one, people should probably be wearing masks, so it's hard to smoke with a mask. And number two, other people around don't necessarily want to smell that smoke or get the effects of secondhand smoke, especially now in the middle of this pandemic.
Are some people exempt from wearing masks?
So are some people exempt from wearing masks? No. And the main reason is because those people that are exempt from wearing masks, it would be the same thing as saying, are people exempt from catching coronavirus? No, we don't know that yet. And now there are those people, and I know some people are scratching their heads now saying, wait, what about people with antibodies? Well, we don't know what that antibody level means. We don't know if it means you have immunity. We think it does. We don't know how long that immunity will last. We think at least a year. We don't know if you need certain levels to get it. So basically, having those antibodies doesn't give you a free ticket to not wearing a mask. As far as other people, what they do say is if you have respiratory problems and the mask causes issues, then you should think twice about wearing masks, but at the same time, you probably shouldn't be in an environment where you need to wear a mask. And children under 2 probably shouldn't wear a mask, or it's recommended they don't wear masks because they can have breathing issues as well. So be careful with them. Again, the same thing. Maybe shouldn't be in an environment where they need to wear masks, especially if we know there's a lot of coronavirus. It's a hot spot. And even though hot spots seems to be quelling down right now, they are going to be coming back, especially as we open up things and especially as we get back into the fall. Next question.
Memorial Day weekend is coming up. What should we keep in mind?
So Memorial Day weekend is coming up. What should we keep in mind? First and foremost, try and have fun this weekend because it's a weekend that we can all take a break. We've all been doing all this sheltering in place, staying at home, all these things that aren't natural to us over the last couple of months. So getting out would be important, but you need to do it in a safe manner. And a couple things to think about. Again, I talk about your quarantine. Your quarantine up until now has probably been your family members, those people you've been living with. And it's usually probably anywhere from 2 to 6 people, it's very small groups. And what I've talked about is expanding that quarantine. And now is probably a good time to do that. Expanding the quarantine means bringing in other people to the group, but probably no more than 10. And these are people you inherently trust. You trust that these people have done the right things over the past couple of weeks to protect themselves. Because if they haven't, they're going to bring germs to you. And what I tell people all the time is you think about it. If you bring somebody to your quarantine or somebody to your party, whoever you're bringing there, you're not just bringing you're bringing anybody they've been in contact with over the past couple of weeks and all their germs as well. And so you have to be very careful to make sure that you trust them enough to have done the proper things, to stay at home, to wearing masks when they're out and about, to protect themselves, to protect you as well. On top of that, if you're going to have, let's say you're going to have a barbecue. If you are going to have a barbecue, that doesn't mean that you have to restrict it to your quarantine. You can think outside the box. What you can do is basically say, I'm going to set picnic tables up. They're all going to be 6 feet apart. And we're going to have people there. We're going to have basically takeaway dishes they can take to their tables. And we're going to make sure we have conversations and have a good time, but we're going to keep that social distancing intact. Very, very important. If you're going to a pool, if you're going to a beach, if you're going to the lake, one thing to remember is you're more likely to catch coronavirus from the people at that pool, that lake, or that beach than you are from the water itself, because coronavirus doesn't live very well in water, and we don't think it transmits from water to people very well at all. So the main thing is make sure you protect yourself from other people that are in the same environments. And that means social distancing. I've talked about that enough. Also, don't share things. Don't share towels. Don't share water bottles. Don't share sunscreen bottles, because that contact, again, even though it's less likely, it still can happen. You want to be very, very careful with that. And if you're going on a trip, same thing. Be careful if you're going on a trip. Make sure you do the appropriate things. If you're driving, make sure that if you stop, that you're very aware of where you're stopping, what you're touching, cleaning yourself, wearing masks so you don't bring it back to the car. If you're flying, same thing at the airports. Wear masks. Most of the airlines these days are asking you to wear masks on the airline. Protects you and other people as well. But probably the overall message here is you can do these things to stay safe. You can go ahead and have fun with friends now, but make sure that you do stay away from them, that 6-foot distance. But the most important thing is try and get out and have a little bit of fun, even if it's just yourself, your family members, as long as you can keep away from other people and do it safely. It's time to have a little bit of fun this weekend because, again, we've been doing everything over the past couple months to try and keep ourselves safe. It's important to keep doing that going forward, but hopefully you do have a little bit of a good time this weekend. Get out in the sunshine, enjoy that with sunscreen, of course, but have a good time. Dr. John Torres here again with NBC News. Thank you very much.